And now Dr. Kevin Campbell, he's author of Losing Our Way in Healthcare. Good to see you this morning. Aside from the main issues here, I kind of wanted to hone in here. I know you're a cardiologist. Have you heard anything about these studies that COVID-19 could be affecting the heart at all?
I actually have. There's a lot of things that are going on right now in academic circles. We're hearing that COVID-19 patients, a lot of them are developing a myocarditis, which is an inflammation of the heart. They're also having heart attacks. They're also having blood clots called DVTs. So there's a lot going on. Some of the drugs we're using, like hydroxychloroquine, can cause lethal arrhythmias, things that can kill you, called ventricular fibrillation. So there's a lot going on. And interestingly, in Wuhan, there's a study that just came out that showed that people who had pre-existing heart conditions that were hospitalized had a 50% mortality rate as opposed to closer to 4 to 5% for those without heart conditions. So it's very complex, but there's something going on.
Yeah, it seems like we're learning something new every day on this. Speaking of something new, yesterday, one of the president's medical advisors, Dr. Burke, she cautioned people about going to the supermarket. Restaurants are closed. You got to get food on the table. What's your best advice to this?
You know, what I would do is plan your meals for the week or for 2 weeks if you can. Send one person from the family into the grocery store with a mask and with gloves if you feel comfortable using gloves and know how to get rid of them without contaminating everything from the gloves. Go once a week, no more than that if you can help it, so that you limit your exposure. Don't bring your family with you. Only have one person. When that person comes in the house, make sure that person takes off their clothes, goes and showers, washes their hands, and don't sit the bags on the counter. Sit them on the floor and make sure you clean everything. I think that's the better part of valor to stay safe with this.
That's great advice. I'm glad you got that in there. Dr. Campbell, thank you, sir. We'll see you again. Stay safe.